in 1 minute to improve your erection. Stay tuned. I want to show you how to do it. But this is a breakthrough exercise that's never been shown before. So you ready for this? So let's dive into this because we're going to talk about the anatomy of the penis and how this works and combining an ancient treatment such as acupuncture along with doing this exercise. It's going to take us 1 minute. So I'm going to add my slide here. So the pelvic floor, the two muscles that are responsible for the pelvic floor is called the bulbospongiosus muscle, which you can see in the arrow in the picture, and the ischiocavenosus muscle. The bulbospongiosus muscle wraps around the base of the penis, and what it does is that it brings in more blood flow to the penis, and it also clamps down the vein on the top of the penis called the dorsal vein. So not only does it bring in more blood, but it clamps down on the vein, blocking blood from leaving the penis, and sometimes helping with a condition that you may call venous leak. It's almost like it works as a wrap at the base of the penis, preventing blood from going out of the penis. And another muscle called ischiocavenosus is at the base of the penis, but it's also on the side of the penis. And again, it works in bringing blood flow, but it also works in assisting with orgasm and ejaculation, as well as the bulbospongiosis. So these two muscles are also responsible for helping you urinate. These muscles contract to start your stream and stop your stream. Okay, so they're important for erection, they're important for orgasm and ejaculation, they're also important for urination. That's why it's near the penis, that's why it wraps around the penis, and it almost works as like a sling on the penis. You can see in the picture with your pelvic floor, kind of like on the floor of your pelvis, kind of holding up the prostate, also holding up the bladder. That's where the urethra or the tube where you urinate goes through, and it connects all the way to the rectum. So it's often neglected because you don't see it, and it's hard to exercise, and it's often neglected, but it's such an important muscle. And that's why I want to point out doing this muscle doing exercise with this muscle along with doing acupressure point at the same time. So a Kegel exercise. So everybody knows Kegel exercise. With this exercise I'm showing you should be done lying down with your knee bent, with your foot on the floor. Kind of like this picture that I'm showing you right now, lying on your back. So how do you contract the pelvic muscle? Sometimes it's actually kind of difficult, and most men do it wrong. I myself do it wrong too, and I talk about Kegel all the time, but I had to go to a physical therapist to learn how to contract it so you don't over fatigue the muscle and you don't contract the buttock muscle or the leg muscle. So that's why you should lie down and relax, and you should actually bring your hand down to the pelvic muscle, particularly kind of like right underneath your scrotal area. So I'm going to show you this right here. So I have a penis ring on this penis here, but you can feel the pelvic muscle right here, right underneath your scrotum right here. But it's the same muscle that helps you urinate and stop, so you can actually feel it as you try to stop your urine stream and start your urine stream again. You can feel the muscle contracting right here. It's very subtle. What you don't want to do when you're doing the Kegel is to contract the buttock muscle or to contract your leg muscle at the same time. So you just put your finger down right here and feel the muscle contract, but at the same time relax the buttock muscle and breathe, and remember to breathe. So I'm going to walk you through doing this exercise. Before I do that, I want to highlight again, start the Kegel lying down and bending your knee. And then I want to show you the 2 acupuncture points that you're going to press on, which is called acupressure. These acupuncture points are major points for erection and sexual function. But one of the points is called kidney 3, and that point is just behind the medial part of your ankle on the inside of your foot, kind of like on the same side as your big toe. And you feel that the malleolus bone, and then you just go in that groove. It's right in front of your Achilles. That's called kidney 3, kidney number 3. So that's one point. And the second point is called conception vessel, or CV4 and 6. And the good part is that this point, as you can see in the picture, is about 4 finger breadth, 4 finger breadth here, right below your belly button. Here's your belly button, 4 finger breadth down. So when you press down on it, you're pressing down on CV4 and CV6. Now CV stands for conception vessel. What you want to do, as you're lying down with your knee bent, you're going to put your hand, your 4 fingers, just below your belly button, press down on it, and you press down almost like a 2-pound weight. It's enough pressure that you can feel the pressure, but not too painful. Same thing, you put your hand on the ankle point at kidney 3, you put your right hand on your belly button, your left hand on just the inside of your ankle, there. And then as you're doing this, you want to start contract the pelvic muscle. You want to contract it and hold it for 5 seconds, and then release slowly for 5 seconds. And then contract for 5 seconds again, hold it for 5 seconds, and release it for 5 seconds. And you can do this first and try to see if you can do it with breathing. As you're contracting the pelvic muscle, you want to breathe out, exhale. And then as you're relaxing, you want to breathe in. So it does take some coordination, like the right hand on your belly button, your left thumb on the kidney 3 point on the inside of your ankle, and then you're lying down. Just try to relax. I know it's a lot of things going on, but you try to do one thing at a time. Maybe at first just start doing your Kegel without touching on the acupuncture point. Do the Kegel first and try to coordinate that with the breathing. As you're contracting the pelvic muscle, breathe out. As you're relaxing, you want to breathe in. You want to contract for 5 seconds as you breathe out. As you're relaxing for 5 seconds. Do that first. Once you kind of do that, you put pressure on the CV4 and CV6.